Estamos aqui no Congresso da Sociedade Brasileira de Arritmias Cardíacas de 2019 e temos o Dr. John Mandrola, que acabou de nos abrilhantar com a sua aula sobre mídia social e educação médica. Hi, Dr. Mandrola.
Hello, Luciana.
Could you explain a little bit about the topic of your lecture, social media and medical education?
Sure. I spoke today about the power of social media in medical education, and I think that social media can be used in many ways to help translate medical evidence to the bedside, to speed translation, because translation from evidence to the bedside is slow. Also, I spoke about how social media is becoming mainstream. Medical journals, medical societies are very much involved, and I really think it's a powerful tool. It's not everything, it's not all that we should do, but I think it's an important additive to regular medical education.
So how important is social media in the context of medical education?
I think it's very important. I think that social media, like I said, is not a replacement, but there's so much to learn from people across the world. I mean, we learn from people from Australia, Canada, South America, and there's just an extremely robust place to be learning things, especially electrophysiology. The electrophysiology community on Twitter, for example, is extremely popular, and you can learn from the leaders in the world rather than have to go to a conference or open a book. You can be right there online.
Okay, and do you consider risks with medical disclosures in these channels?
Yeah, of course there are risks. Everything that's good, every medical treatment you know has risks, and social media is no different. I think one of the biggest risks, and some of the things that I've changed, is I no longer put cases up that are anywhere close to the time that they came about, so that patients can't be identified. I think privacy is really important, and it's sad that we can't speak about cases, but I think that we have to be very, very careful about cases because they're identifiable information.
Okay, and how to get better performance to stand out in front of so much information?
Yeah, so in terms of, this is one of the greatest strengths of social media. In the old days, when I was training and when I came up, you had to have permission, you had to get an invitation to the meeting, you had to have credentials, and then people would listen to you. However, now with social media, if you have good evidence, if you have good ideas, these things can rise up. And so how you stand out and how you get good, I think, is to be really have a good story, have good ideas, and gradually these will come up based on their merits. And this is the part that I most love about social media.
Okay, and what's your opinion about patients' movements? What are the risks and the benefits to involve patients in the discussion about their treatments?
Yes, Luciana, this is a good question. First of all, the first thing to say is that patients are online and patients will follow you. I have patients tell me all the time that they follow me on Twitter. So this is important to keep in mind when you're tapping stuff out online. So everybody's out there. As far as the patient movements go, I think it's great that there are patient movements. Patient forums, for instance. I had shoulder surgery a number of years ago, and I really wanted to hear from what patients said about what they experienced. So this is a positive. However, patient movement groups can sometimes have as many conflicts as say journals or other key opinion leaders, because if, say, a industry pays for patients to go to a meeting, then those patients are going to be pretty favorable to that product that the industry supports. So I'm concerned about financial conflicts of interest with the patient movement online.
Great. And do you believe that doctors are already prepared to interact with their patients in social media?
Yeah, so I actually talked with some Brazilian colleagues last night, and they said that it's very typical for patients to use WhatsApp to contact their doctors. This is not the case so much in the United States. In the United States, we don't use that much WhatsApp, but if a patient contacts us on Twitter or on Facebook Instagram, we usually, I think the right thing to do, at least I thought the right thing to do, would be to take that conversation offline and have it be one-to-one. But I was surprised that so many Brazilian doctors talk to patients on WhatsApp. So again, this is the beauty of social media, is that you learn new ways.
Right. And finally, could you quote some countries where this kind of communication features perform better?
Yeah, so my colleagues in Australia, there's a movement called telemedicine, where we talk with patients online. And my colleagues in Australia, Presh Sanders and John Kalman, they tell me that in Australia, telemedicine is very important because there's so much space between patients, and it's very, very necessary. You know, in the United States, I think it's being used more and more. Of course, the problem with telemedicine is that you cannot do an exam, and you can't be in the room, and so it's difficult. But also, it's like my Australian colleagues say, if there wasn't telemedicine, there would maybe be no medicine for some of these patients. So I think that Australia is really leading the way here.
Great, great. That was great. Thank you very much for your contribution.
Well, thank you for having me.